ability. So the percentage, the amount of fund into each of the sectors of the country is actually not enough. And let me say this: even when budget is being drafted and there is a purported percentage to go to a particular sector, the fact that that percentage is what is written on paper, that doesn't mean that is the amount of fund that government later puts into that sector. So we should have to be careful in terms of the statistics. Yes, they can say, okay, even the percentage we are putting into the healthcare sector is 4.47%. But the question is, how much did the government actually inject into the health sector at the end of the day? Okay. So these are where the challenges are. So anything might just happen at a point in time, and the government will feel like, oh, let's divert this fund to this.
Okay. Now, what are your thoughts on medical tourism, especially with government officials and high-profile Nigerians?
Well, in terms of medical tourism, let me put it this way: it's more of our past. We need to tidy up our own challenge. The fact is that some of the health benefits, the health outcome that people are actually seeking outside the country, they are things that can still be done. Majority of them can actually be done in Nigeria. Okay. Now, this is where the problem lies. In terms of the facilities, the materials and equipment needed to carry out some of these healthcare needs. For example, if you decide to bring in some of these equipment into Nigeria to carry out some of these things, yes, it's actually very good. But then, what about the, for example, electricity? Some of these things run on electricity 24/7.
Okay.
And we know that we don't have stable electricity. In fact, the national grid just collapsed recently.
Yeah.
So, hearing stuff like that, even if you are an investor that you actually want to maybe invest into the health infrastructure of the country as a private individual, when you hear about news like that, you get demoralized because of that. So this tourism that we're talking about, and the leaders are actually they are not giving a good direction to Nigerians, because Nigerians look towards their leaders, and when there's any minor issue or anything, you hear that they jet out of the country to go and seek healthcare outside the country. But the funny thing is, when is the last time we had that a foreign president come into Nigeria to seek healthcare? When? Even last did we hear of maybe any African president coming into Nigeria to seek a better healthcare? As dilapidated, and we don't have all those leaders who are in power. It is to pay for the healthcare benefits of this government official. So it's at our detriment that we are actually seeking healthcare outside the country. But nevertheless, there are still some health conditions that we cannot yet manage in Nigeria. So I have to put that in place. Okay. And that's not particular to the government officials alone. Even even kidney transplants, open heart surgery. We can't do some of those things in Nigeria. So people have to travel out of the country for a better expertise and because it's human life. It's not a car, it's not a phone that you can say, okay, if somebody repair it and it didn't work out well, you can go somewhere else to get it. No, everybody wants the best for themselves.
Yeah. Okay, Pharmacist Sam, now let's talk about how is telemedicine and digital health transforming healthcare delivery globally?
Yes. The way the world is going now, and even with the disruption of artificial intelligence, there is a lot of changes that are actually going on within the health sector. And first of all, the e-medicine So when I say e-medicine now, I mean electronic medicine. Though we've not really been practicing that much in Nigeria, but in other countries they've been doing that.
Okay, so tell
Maybe
us, what
some.
is e-medicine? Can you just expatiate a bit? What is telemedicine?
So yes, it's just basically e-medicine is the same thing as telemedicine. It's basically the use of computer, the use of technology in the healthcare system. So in such a way that there's actually no need for the manual handwritten form of documentation within the health sector. So from the moment the patient gets to the hospital, everything that will be done on the system by the doctor. The drug prescription by the doctor will be sent via email or a form of software to the pharmacist. So the patient goes straight away to the pharmacist to get the drugs, and any form of communication between the doctor and the pharmacist to be done via that communication channel. So the patient also, after getting their medication and all, if they want to reach out to anybody within the healthcare system, there's usually a phone line, a communication channel for them to reach out to speak to them, to let them know, okay, maybe probably there is an adverse drug reaction, or they are not getting the expected results from the medical treatment. They can actually give feedback to the healthcare system. So it actually makes things work faster and better. It creates a form of efficiency and also transparency. So it brings a lot of innovation to the board, and puts the healthcare professional on our toes also to actually do our best.
Okay.
For the patients.
So now, how can international collaborations enhance Nigeria's healthcare system? How do you think? How do you think international collaborations can help enhance our country's healthcare system?
Yes, that's a very good question. One, I feel, especially all these countries that our people are actually going out to seek medical tourism, why can't we ask them to come on board in Nigeria? Even if they won't be setting up a mega scale industry, but at least even for them to even carry out a pilot scale in the country, a satellite unit, having a satellite unit in the country, even if your professionals might not even be residing in the country, but anytime there's a need to do such a procedure, they can actually come into Nigeria to do that. So it will give more people the access to the facility, to the healthcare. So we need all these international bodies, especially foreign countries who have more of these sophisticated equipment. So actually, I believe some of these countries too, because when it comes to about the interest. So I believe some of them are even happy that our politicians are actually coming over to their country to seek healthcare.
It's not just politicians though. High profile, anyone that can afford to go abroad to treat themselves. So it's not just the politicians in quotes, it's pharmacists. Okay, so now
yes, I understand. Yes, I know. Yes, I understand your point. That it's not only actually going abroad to seek a better healthcare, but nevertheless, I'm saying that the foreign countries, they actually, talking of expats, the percentage of Nigerian expats in UK is so much that I believe if the Nigerian economy can become stable, that in fact maybe 1 naira becomes equivalent to £1. I really pray so. You will see that if these people can actually come back into Nigeria, in fact, The
Now,
level of transformation that is going to take
yeah, so
place
that brings me to
will be huge.
okay, now, so let me ask you. You've talked about the role of governments. When I say governments, I mean the three tiers in fixing the health system. But now, what is the role of the private sector and also individuals when it comes to strengthening the health system in the country?
Well, the private sector majorly is a profit-oriented venture. Nevertheless, they are usually the driving force in the development of the sector of, in fact, major countries. So, and private sector majorly, let me put it this way: there are some criteria that private sector have that actually make them better than the government in advancing development in country. The first number one thing is the management of fund. The private sector does not really allow mismanagement or corruption like what we have in government. Two, private enterprise deal with more with competence. They attract competent individual and best of facilities to actually put things in place. So the private sector has a critical role, especially in this current state of the country now. Even though the level of profitability of running a business in Nigeria now is not.
But Sammy, you do know that most of the consultants at the public hospitals own these private hospitals in the country. And also, before you answer that, are there currently public-private partnerships in that exist to improve healthcare infrastructure and services in the country?
Yes, I understand the fact that we have some consultants in the hospital, in the public hospital, owning a private establishment, a private hospital. Yes, I understand that. But nevertheless, it has its advantage and it has its disadvantages too. And the advantage is in the sense that at least it's the establishment they put in place, we actually still serve the masses. But then the disadvantage comes in the sense that when they neglect their responsibility in the government institution and focus majorly on their private business. That's where the challenge comes in. But when we're actually talking of the private sector itself within the health sector, it's not really. I wouldn't really be talking about those who are actually doing the dual business of government and private businesses. No, I would actually want to focus on people who are actually totally devoted to working in the private sector, establishing a private establishment.
Okay.
So those are the ones that will actually be putting my attention to, because they are lifesavers too. They are the ones that put down their resources, taking the risk to provide services and resources for the sake to provide healthcare benefits for people.
Okay.
So, and they deserve to get a return out of it. But I will still admonish that, one, the profit orientation should not be more than the professional services that would be rendered. Okay. This is actually very important, because there have been a lot of allegations as regards inadequate practices and some misconducts within some of the private sector, and the reason is because they actually want to make more profits.
So I also asked you if there are public-private partnerships, that's PPPs, currently in the country to improve healthcare infrastructure and services. Are you aware of any?
Yes, of course. In fact, pharmacies are the major frontier when it comes to the grassroots. In fact, the first contact of the masses, of the common man, is actually the community pharmacy. So you see that when people are having minor ailments, where they first go to is the community pharmacy, because the waiting time, they don't stay there for long compared to when they go to the hospital. So
Okay.
the community pharmacy has actually been a source of healthcare development in Nigeria. And even when you go to some rural areas that maybe you can't even find any form of healthcare infrastructure, like you can't even find any hospital or anything, or you can't even find a primary healthcare, there's hardly such a place that you won't actually maybe find a pharmacy close by or around the place that will still be serving that purpose of providing health facility. And at times, because of that, it will even make people to clamor for health facility within that. I know of a place like that in Ibadan, that area does not have any serving hospital.
Wow.
It was only a community pharmacy that was there. So at the point, the landlords in that area came together and they had to reach out to the government official that at least, even if it is a primary health care, that they needed it there. And I think as of today, they've established a primary health care system for them in that area.
Okay.
So these are the way the private sector has actually been bringing
Involved.
development and opening the eyes of the government.
Okay. So yeah. Now, before we begin to talk about your recommendations, that's solutions when it comes to that you think should be addressed.
Regulation from who?
Regulation, like government regulation.
Okay, government regulation. Yes,
sector.
yes.
Yes.
Yes, it's important. Yes, government is trying its best. I'll still keep saying that, because government is not just people in power alone. We have people who are the government staff that, irrespective of the person in charge who uses just 4 years and leave, they are the ones that will be there for years. And these people keep putting in their efforts for better functioning of the system. So government is trying its best in terms of the regulation. They are trying their best actually, but I still feel they still need to do more.
Do more in what aspect? In what regard?
Yes, one, when it comes to regulation in this country, we are not, in terms of enforcement, we are very poor when it comes to that. You know, there's this issue that trended recently. This man, a very dark man and a pastor like that. Somebody who was selling miracle water or something like that. Yes.
Well, we don't have to delve into that per se, but just generally, because we're on the clock right now. So I just want you to talk about regulation generally. Even there is the issue of traditional medicine now that a lot of Nigerians resort to. I also want to get your thoughts on that.
Okay. Yes. I'm coming to that. So I just want to emphasize that there are still some aspect of regulation that our regulatory bodies are actually not looking into, because people can actually easily fall victim of that. For example, now you see people who sell drugs under the sun. They just put the drugs under the sun. So, and which actually reduces the potency and increases the toxic effects of the drug. So there is a need for our regulatory agencies to actually look more into that, to ensure that some of these drugs actually put under the appropriate storage condition, from the point of entry into the country to the point of the end user. The storage condition has to be appropriate. So our regulatory agency needs to actually work on that. Then aside that, when it comes to traditional medicine, yes, we have a lot of traditional products in the market now that they claim. If you look at the number of claims that they put on some of their products, you will be bewildered. Like, some will even tell you that their herbal product can even cure HIV. They make these elaborate claims, which have not been found. Which I'm very sure, when put to test, most of all these products are going to fail what they claim to function for. So it's the responsibility of our regulatory agencies to actually put in more efforts, put in more energy to ensure that the
So are you saying that they should be
space.
sensitized to know how to produce their drugs more and, get it more involved with research? Or you're saying that traditional medicine should be scrapped entirely? Will
No,
that be the solution?
I'm not saying traditional medicine should be scrapped. No, not at all.
So they
But
should be
then
sensitized or carried along, or how?
no, the thing is that the fact is that we actually have drug laws. We have laws regulating drugs in the country. So, and anything that is termed a drug that should be taken by an individual, one, once the indication what the drug is being said to be used for does not actually perform that function, it qualifies that drug to be classified as a fake drug or adulterated. So there's a need for how would I put it now? A check.
Okay.
A check on some of these products that circulate in our system. And in fact, you even find some products that they even tell you that some don't even have any NAFDAC number. So any product that has not actually gone through the regulatory agencies, there's actually no need for us having them in the market. And I want to implore our regulatory agencies to actually do their best, because when you speak with people, most people come with the claim that that the only thing NAFDAC is all after is just the money. That once you give them the money, your product flies.
Okay, allegedly. Now, let's begin to wrap this up. What would be your recommendations, solutions on how to strengthen the health system in Nigeria? Because we talked about a lot. You talked about regulation of, drugs in the country, even traditional drugs. We've also talked about the healthcare delivery in rural areas, and you questioned some policies and implementation and the role of state and local governments. So we try to cover as much as we can. But now, in a nutshell, how would you say we can move forward in the health sector?
Okay. So in terms of finality, major responsibility still lies with the government. In terms of the allocation of resources for the development of the health sector, the larger responsibility lies actually with the government. So there's a need for a teamwork. There's a need for a teamwork within the health sector. We need everybody to come on board.
Teamwork
all
between who?
healthcare practitioners in the country to come together and look inward into how we can actually make our health sector better.
Okay.
Then there's a need for better welfare for healthcare workers too. In as much as they are trying to, we healthcare professionals are trying to take care of the masses, take care of the public. We also need somebody to take care of us also. So there's a need for a better welfare for the health workers. Then lastly is the issue of health insurance policy.